Good evening, students. Today we are going to discuss about Unit 12A, Infectious Diseases, Viruses, Bacteria and Fungi. That is from MSc, second year. So in this chapter, we are going to discuss about the various diseases that are caused by viruses, bacteria and fungus in fish. So first, let us see what are the viral diseases in fish. The first one is considered as papillomatosis. So it is an epidermal papillomatosis. It's likely a virus-induced neoplastic skin disease. These are benign epithelial tumors which can occur on many species of fish from both freshwater and marine habitats in widely scattered geographical areas. Now, what are the fish that fall prey for this disease? Carp pox, Atlantic salmon papilloma, and cauliflower disease in the European eel. Let us study about the signs, that is the symptoms, clinical signs for this disease. These symptoms can vary from small raised nodules to large, gray to black or white, smooth, loosely attached ovoid tumors on the skin and fins. So oval shaped nodules, you will find them on the skin and fins. They can be either gray color or black. Sometimes it is white. The smooth and loosely attached. It looks like a cottony tumor. So they usually multiple and can appear in any location of the body. And the mean intensity of this disease, it is increased with the size of the fish and was higher in males rather than females. So this disease mostly you can see in the male fish. Now, what is the treatment given for this? So usually there is no treatment for this. Their major problem is the disfigurement they cause. That means the look wise, you will all over the body you find these bubble-like structures. So at times what happens, the surgical removal is also possible. Now, if the growth or in case if the growth is obstructing the fish in its growth and in any way, then surgically the nodules can be removed. See how you can see in this picture how the nodules are grown all over the body, on the fins, even on the eye area. So the on the dorsal side or ventral side, any side you get these nodules can form on the fish body. Next is lymphocystis in fish, the next disease. So this lymphocystis in fish, it is also a viral disease that causes pink or white bumps to appear anywhere on a fish's body, even on fins. Now, it is caused by lymphocystis virus, a member of the Iridoviridae family, and it's common in both saltwater and freshwater fish. These iridoviruses are found throughout the animal kingdom, affecting amphibians, invertebrates, and both freshwater and marine fish. Another fish virus in the iridovirus family is the megalocyte virus. The pink or white nodules that occur in lymphocystis are made up of infected epithelial cells that become enlarged as the virus replicates inside of them. So the virus starts reproducing inside, the number increases, eventually causing the cell to burst. So bumps on the skin are visible because the cell is enlarged from 50,000 to 1 lakh times the size of a normal healthy epithelial cells. Because of this abnormal increase in the size of the epithelial cell, the cells would burst. Now, what are the signs of lymphocystis in fish? The main sign of lymphocystis is the appearance of raised skin nodules, which may vary from a few scattered nodules to a cluster of dozens. They can appear anywhere in a fish's body, including on the lips, but occur mostly often on the skin and fins. These nodules, appearing like warts or tumors, are often pink, white, or gray colored. Aquarists may occasionally notice the nodules on the fish's skin that are darker in color. Early infections may present as a thin film on the fish's body. This lymphocystis is a self-limiting disease that rarely causes serious health issues, but it can significantly alter a fish's external appearance. So contact a fish veterinarian if you notice bumps, nodules, or a film on your fish. A correct diagnosis must be made by a qualified aquatic veterinarian before pursuing any treatment. In the picture, you can see these nodules that are present on the fish's body. Now, what are the causes for this lymphocystis? So, it is caused by lymphocystis virus, a virus that spreads by direct contact of a fish with an infected fish or by coming in contact with a fomite. Once the virus is shed from an infected fish, it can survive in the surrounding water for up to a week. Usually, a decrease in the fish's immunity caused by a secondary stress, such as poor husbandry or water quality, allows the virus to replicate and the fish to start showing clinical signs. Stress impairs immune function in fish and can often lead to a lymphocystis outbreak. Some fish may be latent carriers, carrying the virus, but do not show clinical signs. Due to the long incubation period of weeks to months, the virus may not show up after most quarantine protocols have been completed. You can see the affected fish, how the virus looks also under the microscope. Now, how to prevent this? The best method to prevent lymphocystis from entering into your aquarium is to quarantine all new fish and other live animals added to the tank, including invertebrates, for 30 to 60 days. The stress of capture, transport, and introduction to a new aquarium is often enough to trigger a lymphocystis outbreak if a fish is a carrier. Next, the third disease is infectious pancreatic necrosis. We can also call it as IPN. So this IPN virus is a viral pathogen that infects salmonid fish species such as salmon and trout. Taxonomically, IPN virus is a member of the family Bidnaviridae and the genus Aquabidnavirus. It has a wide geographical spread. Young fish are most susceptible to the disease, while adult fish can become carriers for the virus. The virus is transmitted from one fish to another as well as from a parent to offspring, so via infected eggs. Now, where it can occur, normally in farms, mortalities occur mainly in the fry, that is the juvenile stage. But in recent years, Atlantic salmon post-smolts have suffered considerable mortalities from this disease, especially in Norway and Scotland. All age groups of fish in both fresh and seawater environment can be infected asymptomatically and may shed virus. Now, clinical diseases may be characterized by a swollen abdomen or eyes, darkening of the skin, spiral swimming and fecal cast trailing from the vent. Internally, there may be a pancreatic necrosis or a catarrhal exudate in the intestine and hemorrhages in the visceral organs. This IPNV is an aquabirna virus, the presence of which can be confirmed by isolation in the tissue culture and identification by enzyme-linked immunosorbent assay. This is normally we call it as ELISA test, that is enzyme-linked immunosorbent assay. And antibody neutralization, or polymerase chain reaction. So by these methods, we can identify or we can diagnose the virus that is causing this disease. So as we discussed, it occurs mainly in the juvenile stage and it spreads from mother to a parent to the offspring through the egg stage. Now, the common signs of infection can be severe and include darkening of the body papillae, visible hemorrhage on ventral body surfaces, and abnormal pale liver, spleen, and kidney tissue also. Now, lesions in the pancreas and can also include infected kidney, macrophage, gut epithelial cells, and liver. This disease does not pose a threat to human health, so it only affects the fish. Now, how to control this? This may be vertically transmitted from parent to progeny. So, consequently, it is recommended that any brood stock originating from infected farms should be tested for the virus at the time of stripping, and eggs from infected parents should be destroyed. This is a very robust virus and can be transmitted in fresh and salt water on equipment and can survive in silage waste and in the gut of birds and mammals also, allowing it to be transmitted in through fecal matter. So movement of equipment from infected sites should be avoided and mortalities and other waste should be regarded as highly infectious waste material. Now treatment, a provisional marketing authorization has been granted for a vaccine against IPN. So there is a vaccine for this IPN disease. Next, let us study about the bacterial diseases in fish. Now, what are these bacterial diseases? So because of the rising demand for edible fish, aquaculture is quickly becoming the world's fastest growing food producing sector. However, extensive food fish cultivation has resulted in outbreaks of a variety of bacterial diseases, causing annual economic losses to the aquaculture industry in the billions of around the world. Feeding antibiotic medicated feed to diseased fish is common practice, but it has resulted in antibiotic resistance in bacterial pathogens, requiring greater doses of for effective management, a growing public concern. Now, to treat bacterial infections in aquaculture, a number of vaccines have come. Under this bacterial diseases, the first one is bacterial hemorrhagic septicemia, BHS. We can call it as BHS, bacterial hemorrhagic septicemia. It is caused by Aeromonas hydrophila, Pseudomonas fluorescens, and Aeromonas liquefaciens. Now, what are the symptoms of this disease? This disease is marked by the accumulation of red fluid in the body cavity, destruction of liver cells, green or yellow coloration, necrosis of skin, and inflammation of blood vessels. Exophthalmia, that is the bulging eyes, may also be present. So these are the symptoms. What are those? Red fluid gets accumulated in the body cavity and liver cells get damaged. Green or yellow color liver color. The liver color changes into green or yellow color. And on the skin also you find the necrosis of skin patches and inflammation of blood vessels also we find. So it leads to scale loss. So the scales will be fallen and skin lesions you can see, and the muscle tissue also get damaged. Now gaseous wounds develop on the skin, often accompanied by foul odors. So the bad smell also comes from the wounds of the skins, the fish's skin. Some fish exhibit no external symptoms and they show hemorrhagic of internal organs So outwardly you won't find anything, but internal bleeding will be there, and even on the skin also. And muscle bulging, sometimes eyes are bloated and abdomens are bloated from internal bleeding, and reddish tints to eyes also. Even in the eyes also you can find those reddish tints because of the internal bleeding. Skin, gills, and fins also you can find this. Now, open source, abnormal behavior. What is that abnormal behavior? Taking food and spitting it out. So they can't eat food. They take, but they spit it out immediately. Or they stop eating and they enter the tank from infected fish being added to the tank. And the survival rate is low. And this disease is very contagious. Now, how to prevent this hemorrhagic septicemia? Do not allow contact of your fish with wild fish or fish from other farms. This can be spread by direct contact with infected fish or contaminated water sources. Fish must be brought into the farm. So limit the frequency and number of new introductions. That means new fish should not be added so much. The number of fish should be limited. And most of the broad spectrum antibiotics can be useful in treating this disease. So what are those antibiotics? Nalidixic acid, that seems to work against this bacteria. Now, medicinal treatment of fish, how it can be done. Remove infected fish to hospital tank if possible. And then do not raise the tank temperature. Treat as directed with one-shot knockout, they say. So feed with full spectrum medicated food as directed for one dosing cycle if symptoms continue. So 50% water change in a hospital tank, and you should keep repeating this treatment. So we should not allow more fish into the tank, and you should immediately keep the fish in the tank which is medicine is mixed in that water. Next is bacterial gill disease. It is a common external infection of hatchery, red salmonids, and occasionally of warm water species, which are reared under insensitive conditions. So, as defined by Wood, the name of this disease describes the clinical signs of bacterial infections on the gills. So, that is when the name is bacterial gill disease. So, the etiological agent of the disease is considered to be one or more species of filamentous bacteria, including Flavobacterium, branchiophyllum species, which is a yellow pigmented filamentous gram-negative bacterium. So this is considered ubiquitous in the freshwater environment. It is horizontally transmitted between fish. Now this bacterial gill disease is characterized by the presence of large number of filamentous bacteria on the gills accompanied by fusing and clubbing of the gill filaments. So the gill filaments are sometimes they appear fused or clubbed. This will attack fish's gills, causing them to rot and erode. So the fins will become eroded or rotten. This will make it harder for the fish to breathe. So we may see it gasping. So fish will be gasping for air at the water surface, or at times rapid gill movement we can see. Unsurprisingly, fish will also have little appetite and maybe losing weight also. So the appetite will become less. So it can't eat food. And so because of that, what happens? The fish will lose weight also. Now, what are the symptoms of this bacterial gill disease? Affected fish are usually lethargic and a loss of appetite, just we have discussed. So they don't feel hungry and they become very lethargic and they lose weight. And large numbers of diseased fish gather near the screen or outlet of the pond. Acute epizootics may result in a 20 to 50% mortality in 24 hours. So within one day, there is so much of death rate. Then microscopic examinations of wet mounts of these gills usually reveal extensive clubbing of the gill filaments, lamellar fusion, excess mucus, and detritus. So large number of filamentous bacteria adhering closely to the gills are evident, but necrosis of the gill tissue is seldom present. This is in sharp contrast to columnaris disease on the gills, which may cause extensive necrosis and erosion of gill filaments. It attaches exclusively to respiratory surfaces, including the epithelium lining, the branchial cavity, but not on skin. And it does not invade the tissue. Attachment of the bacteria leads to a toxin-induced reduction in blood oxygen levels, down to roughly 30% of normal under experimental conditions. And this is caused by a prostaglandin mediated vasoconstriction of the blood vessels in the gills. Now, how to diagnose this? The diagnosis of bacterial gill disease depends on the detection of large numbers of filamentous bacteria on the gills. Along with the clinical signs described above, this observation represents diagnostic evidence of the disease. In the absence of large numbers of bacteria under gill wet mount examination, gills with signs of clubbing, filament fusion, etc. should be homogenized on a slide, streaked, stained with methylene blue, and it can be examined under oil immersion. This technique will frequently reveal the presence of the filamentous organisms that might not have been observable in a wet mount. Isolation of a pure culture of the bacteria is not necessary for diagnostic purposes. So how to prevent this? Maintenance of a high quality environment is of utmost importance in the prevention of bacterial gill disease. According to Wood in 1974, he says fish should be reared in a system with no reuse of water until they reach a size of at least 100 fish per LP. Now, population level should be kept at lowest feasible levels to reduce the effects of crowding. The application of good sanitation practices is important. Clean ponds provided with an adequate flow of clean water coupled with prompt removal of dead or weak fish will reduce incidence of this bacterial gill disease. Now, how to remove the disease from fish populations? So just as we discussed, so for most of the diseases, the common things we follow. Avoid crowding and handling of fish during the periods of high susceptibility. Practice good sanitation and keep waste products as low as possible. Avoid rearing fish smaller than 100 fish in reused water or in ponds supplied with water from a source harboring carrier fish. Now, what is the long-term treatment? Treatment of acutely affected fish with chemicals such as formalin, chloramine T, or hydrogen peroxide leads to an almost instantaneous recovery in clinical signs due to no doubt to a reversal of the vasoconstriction and resulting hypoxemia. Wherever possible, use closed, one-pass water use systems to minimize the development of predisposing conditions. Disinfection of water by ultraviolet irradiation has also been shown to be effective in intensive culture conditions. The next is cotton wool disease. So it is also known as cotton mouth disease. It's a columnaris disease. We can also call it as saddleback and black patch necrosis. Okay, these are the different names of this cotton wool disease. Columnaris or saddleback or black patch necrosis. So these are the different names for the same bacteria. Columnaris, that is Bacterium columnar. This cotton wool disease is caused by the bacteria Flavobacterium columnar. It is not a fungus. Despite its fungus-like appearance, it can infect the skin and gills and is of great importance to the commercial aquaculture market. It is rarer in the pet fish community. It is mostly an opportunistic pathogen that takes advantage of a stressed fish with a compromised immune system. So there are many strains within the species, some of which are significantly more deadly and spread more easily also. You can see the mouth of this fish. So that is why the name cotton mouth disease and saddleback. Look at this fish. You can find this, the black patch necrosis we call. Now, what are the symptoms of this cotton wool disease? They are usually noticeable since they are visible, but can often be confused for other fish maladies. The development of fluffy looking skin patches will be the most obvious sign of this disease. So the first symptom you can see skin patches. The most common clinical sign of cotton wool disease is a pale raised patch on the fish's skin. It can be anywhere on the body, including the face, mouth, and fins. These lesions typically have a fluffy appearance similar to a fungal growth. Next, pale gills. In some instances, the skin patches can spread to the gills also. Now, the gill tissue may then appear necrotic or pale when examined. Now, other symptom is they become lethargic. As the bacteria replicates and spreads throughout the fish's system, the pet will feel stressed and lethargic. That is, the fish will feel stressed and lethargic. And the other symptom is difficulty in swimming. So the spreading illness and patches can cause the fish to lose its equilibrium and cause it to have difficulty in swimming also. And other symptom is loss of appetite. So they don't feel hungry, they lose that hunger. A sick fish often experiences a loss of appetite. Now, what are the causes of this wool disease? Now, columnaris bacteria or commensal bacteria and can occur naturally in healthy fish. The fish begin to show clinical signs if it is stressed out or if the strain of bacteria is particularly nasty. The bacteria commonly enters a healthy system when infected fish are added to the tank without the proper quarantine. It is critical to keep a close eye on your tank's temperature. Since columnaris bacteria, they love warmer water around 80 degrees Fahrenheit, which will cause problems faster than if they were present in cooler waters. Now, these are the symptoms which we had seen now. Now, what is the treatment procedure? All fish showing symptom should be isolated into a hospital tank. The doctor will prescribe an antibiotic to be added to the water or provide an injectable treatment. Injectable antibiotics will not affect the biological filter and they provide a stronger treatment option. So we should not inject, I mean, doctors only will do that. We should not try to give injections to the fish on ourselves, on our own. Your fish may require different antibiotics because different fish, so they might require different antibiotics if no sample is sent for culture and sensitivity testing. So what we have to do, a detailed history of the fish, including water treatments, they have to be, which are attempted. So it should be the main reason for deciding which antibiotic is best for the situation. Now, how to prevent cotton wool disease? As with most diseases, this disease can be prevented with proper quarantine. So these are the steps to be followed for quarantining the fish, diseased fish. Set up a completely separate system with separate filtration. First one is quarantine. Set up a completely separate system with separate filtration and other equipment for 4 to 6 weeks. So 2 weeks is not adequate time. And maintaining the correct temperature in a tank is also very important. Now observe the fish. So observe the fish closely during this time and note changes in their appearance and behavior. If you notice something wrong, it is critical to get it diagnosed fast and correctly to make sure it doesn't become a larger problem. By keeping our fish in isolation, we can protect the main system from infection. Now, eliminate stress. So it is also critical to keep the fish healthy in a low stress environment. Make sure all fish have plenty of room to swim. That means the area should be large and number of fish should be less. And a high quality diet is provided and water should be of good quality. The next disease is red spot disease. Now, what are the causes? Red spot disease in aquarium fish is one of the fatal disease. It has always been a major concern for all aquarium hobbies and fish keepers. Now, what are the causes for this disease? The first, bacterial infection. So when we think about why fish get sick, one of the primary culprit is the bacteria. But what exactly are these tiny invaders that can turn a healthy fish into a struggling one? Just imagine our home's plumbing system as an analogy. Just like how small leaks and clogs can cause bigger issues over time, bacterial infections in fish can lead to a serious health problems if left unchecked. The most common symptoms of this red spot disease in fish are red dots on the fish's body, loss of appetite, fungal growth, and difficulty breathing and swimming. But mostly the symptoms of this disease depend upon the type of fish and the causes of the disease also. Light red dots characterizing it with open sores on the fish's body. And the most common symptom is loss of appetite and rapid breathing also we can see in this. And other is inadequate nutrition is also one of the reason. So inadequate nutrition is also an important factor contributing to various diseases in fish, including red spot disease. Fish not receiving a properly balanced diet rich in nutrients such as minerals and proteins are more prone to multiple red pest diseases. Moreover, fewer vitamins and fatty acids in the fish diet impair the immune system and make it susceptible to many fatal diseases. So this is how the fish looks, red spot disease in the aquarium fish. So we need to maintain a clean and healthy environment, maintain stable water parameters, avoid overcrowding, and use a balanced diet. Now, other reason is parasitic infections. So these parasitic infections also cause red spot diseases in fresh water fish, such as hexamita and Ike contribute to for forming red dots on fish's bodies. Ike is characterized by white spots on the fish's body, and if left untreated, can be fatal also. So these diseases symptoms include lethargy, appetite loss, and red dots on the fish's skin. Next is bronchiomycosis. This bronchiomycosis, also known as gill rot, it was first reported to occur in pond-raised striped bass fingerlings. The disease is caused by Bronchiomyces sanguinis, and it's an obligate pathogen and is more common in other species of fish than striped bass. This Bronchiomyces sanguinis grows within the branchial blood vessels, but hyphae may protrude from necrotic tissues. Affected gills are necrotic and hyperblastic because of an interaction or infection due to intravascular growth of this Branchiomyces sanguinis. Symptoms are infections of the gills, anorexia, and marbling appearance on gills due to disturbance of circulation. Now, histologically, the results are hyperplasia. That means fusion of gill lamellae and areas of massive necrosis resulting from thrombosis of vessels by fungal hyphae. Affected fish may succumb as rapidly as 2 days after infection, and morbidity of up to 50% may occur. Now, Scapik clause suggested that the disease was encouraged by waters rich in organic fertilizers, algal blooms, and temperatures exceeding 20 degrees centigrade. Now, what are the other factors that are that work favorable for this disease? Elevation of the water temperature. If the temperature of the water is above 20 degrees centigrade, the disease might increase. Low dissolved oxygen, reduced water flow, overcrowded conditions, and then high levels of nutrients in the water and phytoplankton blooms. Next, let us discuss about the fungal diseases. Fungal diseases pose a significant threat to the health and productivity of fish populations in aquaculture. So these diseases can cause a wide range of symptoms from skin lesions to internal organ damage, and can lead to significant economic losses. Understanding the different types of fungal diseases, their causes, and effective treatment and control measures is crucial for maintaining the health of fish populations and ensuring the sustainability of aquaculture also. Now, under these fungal diseases, the first one is saprolegniasis or winter fungus. This saprolegniasis is also known as winter fungus. It's a disease caused by fungi, usually in the genus Saprolegnia. It is found in freshwater fish, fish eggs, and this is a secondary infection typically seen when water temperatures dip below 59 degrees Fahrenheit and then begin to increase in the early spring. Now, how does it transfer? This transmission occurs through direct contact between diseased fish or fish eggs and healthy ones, as well as through indirect contact via water supply, transport vehicles, and farm equipment also. The clinical signs may include the appearance of cotton-like white to gray growth on the skin, gills, fins, and eyes of fish also. And we also find them lethargic, and there is also loss of equilibrium. In severe cases, the fungus can penetrate deep into the tissues, causing extensive damage. We can see in this picture the cotton-like outgrowth on the, you can see on the gills here, on the scales, and even on the eyes of the fish also we can see. Now, treatment and control measures. Avoid skin damage during fish transportation. Then, providing the right kind of food to maintain fish health. Preventing overcrowding to reduce stress and disease transmission. Disinfecting equipment and utensils to prevent the spread of the fungus. So, these fungal diseases are a major threat to fish populations in aquaculture. There are few diseases like saprolegniasis, branchiomycosis, aspergillomycosis, shrimp mycosis, and ichthyophanosis. These are the 5 most common fungal diseases affecting the fish. The transmission of fungal diseases occurs through direct contact, contaminated water, or food. Uh, Contaminated water or food. Now, how to prevent this? Now, we say prevention is better than cure. So, prevention and control measures include maintaining good water quality, biosecurity measures, and disinfection of equipment. Effective treatment options are available for some fungal diseases, but prevention is the best strategy for maintaining fish health. Now, with this, we have come to the end of this chapter. We'll just look at the summary. So, what are the 3 factors that are involved in fish diseases outbreaks? They are infectious pathogens like viruses, bacteria, and fungi. And these are capable of attacking the fish, and the fish must already be in a susceptible state. And certain environmental conditions such as specific temperatures or poor water quality must be present. That is the reason these diseases will increase. Many fish disease causing organisms are usually present in ponds, and little can be done to eliminate them or prevent them from reoccurring. These organisms alone are usually not enough to cause disease problems. For this reason, disease problems will usually reoccur in fish ponds unless the conditions which cause the initial fish stress can be identified and eliminated. Now, the three main practices that can minimize the possibility of disease outbreaks. These are maintenance of good water quality, proper nutrition, and elimination of contact with wild fish whenever possible. Now, the viral, bacterial, and fungal diseases also discussed here. Now, we have discussed, and we have also discussed their clinical picture, how they look like, the pathology we have seen. We studied about the symptoms and their treatments also. Now, let us see what are the questions that are frequently asked in this chapter. Now, these questions are frequently asked, like explain in detail about papillomatosis disease in fish, explain in detail about lymphocystis disease in fish, explain in detail about infectious pancreatic necrosis, or explain in detail about bacterial hemorrhagic septicemia, explain in detail about cotton wool disease, explain in detail about red spot disease, and explain in detail about saprolegniasis. So when these questions are asked, we need to explain the name of the disease, the causative organism, and the symptoms, causes also, and the preventive measures, and the type of treatment that should be given. So all these, we need to write them in points. So hope you'll have understood this chapter. Thank you.